Hi, I'm Tom Lynch, Two Things. Today I'm here with Tim Ferris. Tim is the Senior Vice President for Population Health at Partners Healthcare. Tim, I want to ask you two questions about Medicaid. First, in the state we've seen a large transition to Medicaid as the insurer for many citizens in the state. Why has that happened?
Well, Tom, it looks like over the past few years, the number of companies that are paying for their employees to have health insurance has declined in Massachusetts. And what those companies are doing is, for their low-wage workers, they are letting them go on to the Medicaid rolls instead of paying for health insurance.
And that has led to an increase in people who are covered by Medicaid.
It's led to an increase in people covered by Medicaid, so that it has had a big negative effect on the state budget. And the governor and the legislature are currently scrambling to figure out how to cover that budget deficit.
And one of the ways that the state is hoping to improve the care of Medicaid patients is to more of an ACO type product. And you've been leading that effort for Partners Healthcare. Can you tell us a little bit about where that stands?
So at the same time that this is going on, the state has been trying to address its budgetary problems with Medicaid. And the way they're doing it is very similar to how we've been working with Medicare for the Medicare population with ACOs. The idea is fairly simple. For the patients we take care of, every year we get a budget target for the costs of those patients. These are our primary care patients. If we go over that target, we pay a penalty. If we go under that target, we get to share in the savings. And that program, a pilot that we are participating in, started December 1st of 2016, and it looks as though the state is on track to start the full program on January 1st, 2018.
And will we be able to use some of the infrastructure and some of the lessons that you've learned with the Medicare ACO to be able to help with Medicaid?
So we are in a really good position because we've already built a lot of the infrastructure necessary to do a better job of taking care of this population. So that's the good news. This population does have some specific needs that we will need to build a little bit more. Not surprisingly, these are mental health needs, and they are sort of what we would call wraparound services for the severely disabled. So we're going to develop an ambulatory ICU. Eric Weil is leading that effort, and we're going to add some structure to our mental health services in order to do a better job caring for these patients. But the good news is we are already on track and have invested a lot already to be successful at this new effort.
Tim, thank you for your leadership in this area, and I look forward to seeing and watching how we can improve the care of this incredibly important patient group. I'm Tom Lynch, and that's Two Things.